So I suppose the key of these challenges is that the alcohol industry is a determinant of consumption, and its activities specifically in the area of communications are important and ones that we really need to think about. These periodical peaks in advertising and saturation sponsorship in some sectors have impacts, and we should be thinking about what sort of impacts we are prepared for them to have. Now, the focus on culture was actually noted by the National Preventative Health Task Force, and they recognised the importance of cultural place and availability as a modifiable determinant. It wasn't something that was written in stone that we have alcohol in the cultural place that it has, that they see this as modifiable. They also gave a rating to strategies within their document, and if people aren't doing anything on a Saturday night, again, a nice little read is the National Preventative Health Task Force report on alcohol strategy. And where they give a rating of the effectiveness and the evidence base for different strategies that they recommend or they review in their document. And you'll see at the very top there is that there are strategies that regulate the physical availability of alcohol. Second most are taxation and pricing, drink driving, countermeasures, treatment and early intervention, regulation and promotion, education and persuasion. These last two categories of activities are the ones that have the weakest evidence base and the weakest evidence of effectiveness. However, it's the one that we tend to go to most easily. We just need to educate these young people. We just need to get the information in their heads. Now again, if we're on about cultural change, then we need to do more than that. We need to actually think about the material environment in which these people are living, and we need to think about the media environment in which they're living, because this is the environment that is actually peppering us with ideas about how we should be in the world. Now, when we think about, and this is, I'll get out of the wacky stuff now, we're into more orthodox things, so I'm going to leave the neuroscience behind, and we'll talk about this idea of integrated campaigns. Now, what I've done here is I've inserted a figure from a Scottish Tobacco Control Alliance. Now, this was an alliance from around 2005-06 where, and what I want to show from this is I really don't want to talk about tobacco, but show you the depth of complexity through which people who do planning for advocacy for culture change plan to bring in and integrate the activities from a number of different areas and bring them across a whole range of stakeholders. And we at Vic Health do this all the time. When we want to run a campaign on soft drinks and obesity, or if we want to run a campaign on tobacco or reducing unwanted smoke in outdoor dining areas, then we draw these kind of pictures where we actually say who needs to be involved in this discussion. We don't assume that everyone's going to agree, but who needs to be part of this discussion in order to affect change. Now, one of the most recent ones that you'll probably hear about is the National Alliance for Action on Alcohol, which is a national organisation, a national collection or a network of around 50 organisations who, again, don't necessarily all agree on things, but do come together to actually assist established stakeholders like the ADCA and ANCD and other players to actually provide a voice at a national level to provide some leadership around influencing the culture that we are embedded in. So integrated campaigns need to have a couple of features. One is you need to engage your stakeholders. Now, most people would know this campaign. It was called from the RTA in New South Wales, the Pinky campaign, or the No One Thinks Big of You campaign. Is that one of yours? Yeah. No. Now, this was widely celebrated as a campaign that actually worked on a number of different levels, which is what multivocality basically means. It spoke to different audiences in different ways. Does anyone know the story about what happened in the TV commercial? Okay, so you've got... I won't do that because that's actually not really helpful, especially if you're going to take my picture going like that. Nice work. Now, the Pinky campaign was one where it was appealing to hoon drivers, and especially in rural and regional environments, where the point of the campaign was to talk to the boys and say, is this really being a big guy? And one of the gestures was used was to hold up the pinky as a measurement of penis size. Now, the point of it was not just that the girls would do it or mums would do it, but here they would have the boys in the back seat doing this. So it actually was speaking to different audiences in different ways. It was speaking to women as a kind of modelling behaviour to respond to Hoon behaviour, and it was speaking to men, again, modelling to the men, that they can actually say something like that when someone's driving in that way. And this is a kind of multivocal, speaking to different audiences and creating different effects. Thanks. One of the other features of being strategic in your approach to changing culture is that you've got to treat the alcohol consumers essentially as media consumers. And we know, I think you've already heard this morning, some discussion about the changing media consumption landscape amongst young people. We know that 9 million Australians now interact by social networks, that there's content sharing is the most popular activity, that there's a huge amount of energy in sharing photos, Twitter, reading wikis, and interacting with companies via social networks. What we also know is that although there's a continuing debate about how real the digital natives category is, that in terms of some of the changes between 2000 and 2008 and 9, this is from a Nielsen media review, that you can see some of where the activity is moving, that in terms of people reading messages on Twitter and interacting via social networks, that these are the main areas where there's actually growth and changes in people's utilisation of the different media channels. Now this provokes an enormous challenge for health promotion. No longer can we actually just talk about what's called TARPs, which are measures of exposure of your social marketing message through broadcast media, through a target audience. That here the capacity to actually engage through a range of different channels is actually a real challenge. And the ways we're monitoring and measuring that have also got to adapt to that as well. What I want to briefly say, just to actually talk about trends in other places, is to actually notice that around some innovations in the marketing of alcohol, some marketing of junk food, that there are innovations in marketing healthy alternatives. So this isn't necessarily coming from social marketers or from governments wanting us to eat healthy for the public good. But has anyone seen the Extreme Carrots? So the way the Extreme Carrots, this is produced by carrot producers in the US who produced a series of TV ads and viral videos where they actually were taking were mocking and doing a parody of the extreme junk food genre of advertisements. So this figure here with the helmet is in a shopping trolley jumping over the edge of a cliff, trying to catch in his mouth the baby carrots being shot from a cannon. And it's done to a heavy metal soundtrack with a voice going, "Extreme carrots, extreme," like that. And thank you. And has anyone heard the ad? Was it good? Thank you. Yeah. I've heard it too many times, I can tell you. This particular Eat 'em Like Junk Food was incredibly influential and incredibly picked up. It had enormous pickup. Whether it actually changed behaviour or not is another thing. And that's one of the challenges that we've got, is that although there were material changes, they started packaging up the baby carrots in special junk food packs and sticking them into food vending machines in schools in New York and in Ohio, that even though they did that, we're not quite sure about what impact it's had on consumption. And likewise, the story being told about this marketing campaign is about the marketing campaign, not necessarily about the carrots, which is not bad. It's a funny campaign. Next, please. Again, we take the risk when we do social marketing campaigns that we make the focus about the campaign and not necessarily about the behaviour change. And so the challenge for us is to actually put the focus on how that marketing campaign integrates and links to policy changes and changes in the material environment. And that's a challenge that we all have. Next, thanks. Finally, I just want to talk about social licence. In this, and I gestured to it earlier, a social licence is actually the expectation that we grant, or the expectation that we have, that a business operates in a manner that's attuned to community expectations. Now, this is actually borrowed from the minerals sector, where mineral companies actually talk about the social licence that the community grants to the mineral extractor to actually extract the minerals and damage the earth, but we grant them a licence to do so because of the social benefits that emerge, i.e. the money that comes back into the community. And so things like the Mineral Councils of Australia use the language of social licence as a way of communicating to the community to say, we're listening to you, we hear you, we know that what we do damages the earth, but what we do is that you grant us a licence to do so, and we need to hear you and to actually abide by your expectations. Next slide, please. Now, there are different levels of social licence. This is not mine. I've adapted this from somebody else's work. But if we actually look at this, what I think this is interesting is that implicitly we grant the alcohol industry a social licence. We say, we know that alcohol produces harm. We know about the violence. We know about the family incidents. We know about the effects of intoxication. We know about the hospital admissions, the ambulance attendances. We know about the chronic liver disease. We know about the cancer of the throat. We know all that stuff. But we grant the industry a licence to produce this product because we think the product has social utility. And that's our responsibility. We grant the industry a licence. But how far does that licence go? And where are we on the continuum or the different levels of social licence that we grant? Are we co-owners? Are we united against the critics of alcohol? Are we in the area of we provide approval and support where we actually see the producers of alcohol as a good neighbour and we actually work and collaborate with them? Are we not that far down the track? Are we more about acceptance and tolerance where we see the lingering and recurring issues and threats from the product, and we see that there's lots of NGOs who are watchful and monitoring about the activities of the industry? Or are we further down the track where we actually withdraw the social licence for the alcohol industry to produce the product, where we actually say no, where we blockade, where we stop, where we sabotage, where there are legal challenges? Sounds like tobacco. So somehow I see tobacco as kind of where we've actually withdrawn the social licence for the tobacco industry to produce tobacco because we've actually said, no, we're not comfortable with that. Now, where do we sit on this in this continuum? Where would you sit? Because I think that's an interesting debate for us to have. What level, what licence do we grant to both the producers and the retailers and distributors of alcohol for this product?